Hi, Dr. Gibson, Dr. Kim here, coming to you virtually for TCT 2020. Dr. Kim, I had been very involved in the Twilight study. Ticagrelor Monotherapy in that trial showed a reduction in bleeding and pretty similar ischemic outcomes. But you looked at the STEMI patient, a very high-risk group of patients in the TICO-STEMI trial. Talk to us about TICO-STEMI.
Okay, so TICO-STEMI study is a sub-study of the TICO trial evaluating the role of P2Y12 monotherapy only targeting for ACS study. So previously, global leaders and Twilight study already evaluated the role of P2Y12, especially potent P2Y12 inhibitor. However, the TICO study was only targeted ACS patient, and also its previous trial is a Twilight or global leaders exclude the ST elevation MI patient. However, our TICO trials include the include the STEMI patient. So the unique is that's why is STEMI patient included, and also in this study we evaluated the feasibility and safety of the Ticagrelor monotherapy after 3 months after in a patient with the STEMI treated by the TS.
Well, very, very important. You're filling in a gap where we didn't really know, with, as you say, global leaders, Twilight, we didn't have a lot of data on the STEMI patients. That's why TICO-STEMI is so important.
Yeah,
so tell us what you found.
Finding?
Yes.
Okay. So and also especially for the TICO-STEMI study is random stratification was performed by the presence of the STEMI. So finally the 1,103 patients was enrolled and randomization was performed. This number is about 36% of the total TICO patient, and also the same primary and secondary outcome of the TICO trial. Primary outcome is net clinical benefit defined as a teeny major bleeding and major adverse cardio cerebrovascular events, including the death, MI, stent thrombosis, or TVR. So in first is net clinical benefit is there was no significant difference between the TICA monotherapy and 12 months depth. However, in the S-treat analysis, a little different is S-treat analysis is the Ticagrelor monotherapy showed significantly improved, meaning the good net clinical outcome. So in the bleeding outcome, so as everyone can expect, so on various analysis, consistent finding is a Ticagrelor monotherapy, definitely low bleeding rate. So as for the MACCE, is statistically there was no significant difference on the ITT and S-treat analysis, and also so actually TICO studies randomization was not performed at 3 months. So randomization was performed after PCI. So the landmark analysis, 3 months landmark analysis is very important. Is 3 month landmark analysis was consistent to the intention to treat analysis. So the finally we can conclude for the patient with STEMI, so Ticagrelor monotherapy would be beneficial in regard the reduction of bleeding. So actually there was no increasing of the MACCE. So this is the first report patient of the STEMI regarding the monotherapy of potent P2Y12 inhibitor. That is the summarized conclusion of the TICO-STEMI study.
Excellent. Well, very consistent with what we found in Twilight, right? A reduction in bleeding,
Right.
which is an endpoint we all care a lot about, but no penalty in terms of increased risk of thrombotic events,
Right.
which is good. And, you know, we had gone 3 months before we got randomized. You just went much shorter. So your patients had a shorter bleeding stress test. So you probably had a little higher risk of bleeding than we did. So a different way of looking at it as well, but very, very consistent results. It's very good to hear. So does this lead to a change of practice in your patients?
Oh, sure. Yes, definitely. So as you can see, is East Asian patient also usually had a very high bleeding risk. So anyway, the final result of the TICO and Twilight may be the different ratio effect. Anyway, the consistent effect. So the I think for the East Asian patient, more beneficial by the Ticagrelor monotherapy because of the larger population in the Asian patient. So I think definitely this is good for the Asian patient, including Korean patient.
Well, Asian patients have a little different disease process. They have, in some cases, an amyloid angiopathy and a little higher bleeding risk, as you say.
Yeah,
so
yeah.
Probably very good for your population, but I think it's very consistent with Twilight, which we find also very beneficial throughout the world. Well, Dr. Kim, congratulations. Great work. Great presentation. Thanks for sharing with us. And thanks to all of you in the audience for joining us here virtually from TCT 2020.